Welcome to the show, everyone. I'm JJ Flizanes, your producer and empowerment strategist. Thank you for downloading today's episode. Today, we're going to talk about mistletoe therapy, and we've got back Dr. Nasha Winters. It is her 5th time on the show, I believe. She's no stranger to this audience and to a lot of the guests, actually, that have been on the show recently. So I look forward to having her share with you the amazing attributes and healing properties of this plant and how people can benefit from it. But before we get to that and a little bit more about Dr. Nasha, this is, if you're listening to this in real time, it is Tuesday, May 24th, which means we have 2 weeks left this week, and actually not even a full 2 weeks. We've got maybe a full week. Yep, actually we have 8 days. You have 8 days to buy your ticket for the Awaken Your Dream Life event in October. We are currently offering early bird ticket prices. And again, I've made a 5 payment plan to make it super easy for you. It's like $150 a month for 5 months, and it gets you a ticket to the Awaken Your Dream Life event. And I have to tell you that I'm so excited about this event. Every event changes. For those of you that have been to multiple events, you know that. It never stays the same, and it grows as I grow and as I learn and add more tools to my toolbox, and I see a need to share them with you and a way to get to the next level. That's exactly what we're going to do. So I'm super excited. I'm not even going to share what we're doing like fully at the event because, again, it's a transformative experience, and if you've listened to the show for a while, it incorporates a lot of the things that we've talked about. So I don't feel like I need to tell you what we do at the event because if you trust me to listen to the show, trust me that this is a transformative event. So the website, you have to click the link in the show notes to get the direct website, or you have to type it in because it's not on if you just go to jjflizanes.com, you're not going to find it there. That will change later this year, but I haven't had time to focus on the website. So it's jjflizanes.com/dream life. All right, /dream life is really all you need to remember. Just go jjflizanes.com/dream life and get your early bird ticket. Ticket prices do go up on June 1st. So I hope to see you there. It's an immersive experience because it's necessary. I just see so much transformation. And later in the next couple of weeks or even months, you'll hear from some of the people that went to last year's event and the amount of transformation they had and are still having just from showing up, getting out of their comfort zone and doing something new. And of course, having the change that happens neurologically and even biochemically to a certain level when you show up at a live event. All right, so today's show, again, Dr. Nasha has been on many times, but in case this is your first time with her, she is a sought-after luminary and global healthcare authority in integrative cancer research. She consults with physicians around the world, bridging ancient therapies with advancements in modern medicine in the digital era. A personal journey with cancer and a medical career spanning over 27 years has Dr. Nasha on a mission to educate and empower the nearly 50% of the population expected to have cancer in their lifetime. Her quest to save her own life has transformed into a mission to support others on a similar journey. Dr. Nasha travels the world to explore integrative cancer clinics, vet cancer protocols for research projects, speaks at conferences, and meets with colleagues to help them apply metabolic approaches with their patients. Enjoy today's episode. Welcome to the show, everyone. If you are finding me for the first time because you were looking for Dr. Nasha Winters, here she is. She is back for like the 5th time, I think, on YouTube. Just want to let you know this is my show. What that will mean is I'm going to talk. So if you don't like me, totally cool. If they want more of you, I think they can go to drnasha.com. But is there any other place you would recommend people to go to find more of just you if they're not so keen on me?
Oh, hilarious. So drnasha.com, drnasha.com, or mtih.org. So Metabolic Terrain Institute of Health is what that stands for, mtih.org. And you can gobble up all kinds of bits of information about me and all the work we're doing on those sites. So thanks for that.
Most of the people that find me through you or find you and me together usually are on similar wavelengths, but you never know. So I'm just putting that disclaimer out there. It's helping the haters not give me a negative comment because they're like, why is the host talking so much? I'm like, host, it's my show. Thank you very much. All right. So today we are talking about, your new book, the Mistletoe book. I'm so excited. Mistletoe and the emerging future of integrative oncology. And this has been in the works for a long time. It's one of the reasons when I picked up the metabolic approach to cancer and was flipping through it before we had our very first interview, before I'd ever met you. My life has changed so much since I've met you, much for the better. But I was noticing because Suzanne Summers had in her book years ago about mistletoe, and then I saw it again in your book, and I was like, oh, mistletoe, because I'd always thought that feels really good. Like if I was to ever deal with cancer, mistletoe feels like a great thing I would do. And of course, she didn't go into it in great depth. She had some doctors she was working with. So this was a great connector for me to even feel more connected to you, because intuitively I was like, oh, this feels good, mistletoe. So let's start out with when and what sort of attracted you to, I mean, you've been studying cancer. If you haven't heard Dr. Nasha on the show yet, I mean, literally this is her 5th show. So go back and I'll list all the ones underneath. But in terms of mistletoe, like, let's talk about the excitement of even starting the project of doing the deep dive into mistletoe.
Sure. Well, let me give you a quick background on the book so that everyone knows that this is a book that is written nonprofit. All the funds go to research and more clinical education for physicians to learn how to employ this amazing therapy. It is co-authored with a collection of brilliant minded and souled individuals from all over the United States and out of Switzerland as well, from a hematologic oncologist to anthroposophical doctors to naturopaths to everything in between. We cover the gamut and truly are an integrative approach to this. And this book was born from trainings we were doing with physicians. And we realized that we needed to have kind of a best practices for doctors, but also a good communication manual between doctors and patients. And so that's where the book kind of came from, but it had been in the works for some time. It almost birthed itself a few years prior to that. And it's been something when I was training physicians all over the country prior to that first book iteration. We knew this would have to come eventually. So it was way more fun to bring on and be brought into a group to do this together. So that in the beginning of the book, we're able to talk a little bit about our experiences with mistletoe. And for me, it was a patient that came to me, well, further back from that, as you alluded to, no one gets into the oncology world unless they themselves have typically been touched very intimately by it, either directly or indirectly from someone that's very, very near and dear to them. Like, no, people don't wake up and go, I think I'm going to work with oncology. Like, that's just not how it happens. And as JJ will tell you, it's a heavy field. It carries a heavy weight to it. And so even how to navigate through it as a practitioner is a skill set. And people like JJ are helping me through my own process of that, because it's, it elicits such despair and such terror, and this kind of cultural ripple that puts people, as we were talking about before you started recording, into a state of such white knuckling fear, terror, so much so that they're so afraid they're going to die that they actually forget to live. This happens a lot. And as I was telling JJ right before we started recording, I had a really unique experience that at 19, given a terminal diagnosis in which they thought I'd be dead in a matter of weeks to 3 months maximum, even with treatment, because I had no illusions, I didn't expect to live. So I had to fully surrender to the process, and I had to just sort of get curious about, well, I'm interested in why a 19-year-old would be dying of a stage 4 disease that's usually affiliated with, women over the age of 60, where it was like a zebra through all the things. So that has led me on a 30+ year journey into the field of oncology in general, integrative oncology in particular, and about, I don't know, maybe 5 years into my process. So I was diagnosed in 91, maybe in 1996, somewhere in the early years of medical school, I heard about mistletoe, but I didn't know anything about it, didn't have any access to it. No one recommended it for me. I didn't think of it for me. It was not until about 2003 when I was in clinical practice and I had a patient say, hey, I heard she stage 4 breast cancer patient at the end of her ropes, nothing left to do really. And she said, I heard about this therapy. I ordered it on Amazon.
She ordered mistletoe therapy on Amazon.
On an online, she started already on Amazon in 2006, but in 2003, she found another online site to get it first, but she was later able to keep it going on Amazon, as were hundreds of other patients, until Amazon and the FDA got wind of that, changed that streamline, which is kind of ironic. But she basically said, I've purchased it and I'm going to use it myself and I'd like your help. because it's an injectable, right? This is, and she's like, I don't even know how to give myself a B12 shot. So if you could help me with that. I'm like, I was sketched out, it's like, how legal is this? So, that's kind of my little 2 cents up there. The first time it was sort of like, So basically I said, I will learn with you and we'll learn this together and we'll figure this out together. It gave her like another 4 years of unbelievable quality of life, that it was where they were expecting her to be gone within a few months. And so I was definitely smitten by it. And it wasn't until probably 2011 that I first used it in myself as an ongoing pushback for my own medical issues and my own cancer history. But by the time I started using it on myself, I'd already used it in dozens and dozens of patients. By the time I left private practice in 2014, 2015, I was one of the hubs of mistletoe therapy in the United States. And so I got to then start teaching physicians and other patients and got to be known for it. And people flocked from literally all over the world to our clinic in little Podunk, Durango, to have access to this amazing therapy. So that gives you a little background to how I was exposed to it. So really a patient brought it to my attention and pushed my hand in using it despite my resistance and sort of fear around getting in trouble to use this. And now I shout it from the rooftops. This is such a profound therapy. In fact, mistletoe is the most studied integrative oncology therapy in the world. So we can leave it at that, take a breath, you dive into where you want to take it from this point on. But I thought just that context might help your listeners understand, like, who is this lady? What brought her to this conversation, and what is this book all about? So
unless they found me yesterday, like I said to you in a text message, you're probably the second name I say on the show more than my own. Oh, so whether they've seen you yet or not is, they're not living under a rock. So, right, like literally, because I have people that stay with me for like years and years and years. But if they're just finding me now, and this is your first show, again, like I said, this is her 5th show. So there's a lot of information that we have that you can take advantage of. So what really excites me about mistletoe. And again, I was reading Suzanne Summers' breakthrough. It had nothing to do with cancer. It had to do with metabolic and metabolism, and it had to do with hormones. It had to do with, breakthrough in health and optimal living and optimal blood work versus what, allopathic medicine, as long as you're within the range. Forget that the range is huge. Looking at, don't we want to be optimal? Shouldn't we be like super healthy, dead, instead of decline, dead? And so when I saw mistletoe, I was like, okay, cool. I put that in my back pocket. I would try that. And you talking about like when your path with your health, I mean, you know me, I'm the person who says, oh, you have something preventative. Can I take it preventatively? I'm like, can I take mistletoe now? How is it? So let's talk about how it's used, when it's like, why would you not want it? Like, is it something that a healthy person could take to help anything? Or is it only when you have something that needs to be killed?
That was a really good. This is starting to take to be killed. That's perfect. Well, first of all, just a little context about this interesting plant, because that will help answer the questions of who could use this and who has a good response. And so the use of mistletoe as a whole plant from like herbal medicine background has got thousands and thousands of years history. In fact, there's a really cool in Homer's Odyssey, and there's one other sort of mythic writings from the times that talk about mistletoe, and even from Druidic times, they talked about how those who had lost a loved one, they could take a sprig of mistletoe at a particular time of year and basically go into the underworld to visit their love. That was this sort of myth around it. So it definitely had some connotation around rebirth, the veil, a little esoteric woo-woo, maybe even paganistic on some level, but it was really fascinating for that. So what we kind of know of mistletoe today, at least in the Western mind, is this little lovely sprig that we kiss under at winter. And so, in the winter months around Christmas. And what's very fascinating, that's a significant part of this story, is this plant. It's like a little alien plant in my mind. It's so fascinating. It never touches the ground. It is grafted on trees by a bird called the thrush that eats the berries, poops on the tree, grafts the seed into the bark of the tree, which then a mistletoe will sprout and grow. And so you've seen these in nature. They look like big round balls in trees, which we'll catch up to what that means in a moment. But It all propagates inwards. When it grows into the center. All the other plants grow out towards the sun. It only grows a few leaves in the summer. It grows berries in the winter, unlike all the other plant kingdoms. So it grows out of sync with the world around it, with nature and the rhythms around it. Another clue, hold on to that thought. So when you're thinking about when you're out of balance, when you're out of circadian rhythm, when you're out of rhythm of life in general, that might be a time to think about this plant. Fast forward, Hippocrates, he used this plant for all spleen conditions. And in Western medicine today, what we understand the spleen to be, it's an immune organ. And it's an organ where we develop more blood cells. So it's part of our marrow and part of our immune system, a very important piece. From Chinese medicine, the spleen, and I know JJ speaks a lot this because you're totally into the Chinese medicine, organ systems and whatnot. This is all about how we digest and process information from the outside world in. It's the way we meet the world and ingest the world and process it and utilize that information. So when the spleen is weak, we don't do that very well. We kind of get hit with this. So again, think about being out of rhythm, not being able to digest what's coming in and at you at all times. So wheels are probably turning here. For years beyond that, it was used for things like rheumatic problems. So arthralgias, joint pains, migraines, seizure disorders, cardiovascular issues like high blood pressure. So it's had a lot of cool stuff around circulation and around nervous system tonics and pain support. So thinking about the big picture, but lo and behold, this kooky philosopher from Austria back the late 1800s, early 1900s, good old Rudolf Steiner. A lot of your listeners might know, they might not know Rudolf Steiner, but they definitely have maybe heard of Waldorf school, Waldorf education, or maybe they've heard of permaculture, which is a type of agricultural practice that's very focused on the biorhythms of the seasons around. And then also anthroposophical medicine or anthroposophical philosophy. And so Rudolf Steiner started to observe in nature this concept known as the doctrine of signatures. And doctrine of signatures, when you're like, that nut there, that walnut looks just like a brain. I wonder if it's good for a brain. And sure enough, it's good for your brain. Well, that's what Rudy did. He looked up in a tree and he's like, that looks like a tumor. I wonder if that's good for a tumor. Now, that would be pretty cool, even right then and there. But somehow this guy, this is 1917, he realized if you take a few leaves from the summer, if you harvest a few leaves in the summer, and then you harvest a few berries in the winter, and then you put them in a centrifuge or you put them in a macerator and you chop them up and you freeze them to open up the cell walls. And then you put them in a centrifuge that runs in opposite directions, inside going one direction, outside going another, creating a torus. You've probably talked about that on your shows at some point, which is a particular energy flow that are red blood cells, the planet. There's so many things in nature that mimic this profound energy of the torus. Doing that while dripping very thoughtfully and precisely water into this torus created this particular infusion. It's not like you just took a bunch of plants, put in a thing, macerated it, put some alcohol in it, made a tincture, bada bing, bada boom, you've got mistletoe. No, he did all these weird alchemical processes to make this, which is still to this day, it's manufactured in an identical way around all these places. And when you do it in the other ways, like I just mentioned, the bada bing, bada boom way, it does not have the same effect on cancer cells. So he found this amazing woman, Ida Wegman, a medical doctor of her time in Switzerland, and they started trying it out on cancer patients. It started to be used in a hospital cancer setting in 1921 as an injectable. From that kooky torus spinning process that he somehow downloaded, I don't even know, that's the only thing that makes sense to me, that we actually started only doing, like we started doing research on it in the 30s and the 40s and 50s, over 3,600 clinical trials worldwide, research from animal studies to cell line studies to human studies, everything in between. Even just completed a phase 1 clinical trial at Johns Hopkins on using it as an IV. And here it is, over 100 years later, this medicine is still the most studied and most utilized integrative cancer therapy, and very specific. It's European mistletoe from the Black Forest region of Europe, growing on particular species of most common are apple, fir, or pine are the most common, although there's other species. but it's got this particular lectin content, this particular glycoproteins, these particular viscotoxins, these chemical constituents that have these very particular anti-cancer treatments. And so to me, I get blown away. I tell that story, and I know I'm going long-winded here, but it's so stinking fascinating that someone would know how to process this, and how, yes, it had been used for millennia prior to that time, but suddenly its use got turned on its head and manufactured in a particular way that when you compare the whole tincture or a capsule of it to how it's injected either subcutaneously, intratumorally, IV wise, they don't behave the same way. The magic of its creation, of its manufacturing process, has done something to potentize and change the expression of the particular molecules in that substance that make it have a very profound effect on the immune system. So I love these stories. So when you're like, where can we use it today? Well, kind of looking at a world of really screwed up immune systems right now. So that should probably be a clue. There's actually some really interesting studies happening, not yet published. We aren't sure if they ever will get published, but maybe just planting that seed that there seems to be some efficacy and power of utilizing this therapy in certain viral situations, especially for things like long haul syndromes of these types of things, resetting that rhythm, recalibrating the immune system that's kind of broken in most of us, I think, to this day. Obviously, cancer is an obvious place where you'll use this. And a lot of my colleagues, I have colleagues who use this in Lyme and co-infections and even autoimmunity. You have to use it a little bit differently with folks with flaring autoimmunity, but we can use it as sort of a general recalibration to the whole system. And the folks from the anthroposophical world say very specifically that mistletoe is here to restore the rhythm. And so let that kind of settle into the ethers of your listening experience here, because that's really what I see happen in people, is it resets something in them.
So where do I get it? How do I take it? How much do I need? No, I'm kidding. Right. Like, do I have to wait to get cancer? I'm not going to wait. I'm going to get cancer. But, I love this explanation. I mean, as we've talked about before I started recording, and about the power of, like a client listener. She's not a client. She's a listener who purchased one of my intuition courses, which helped her to identify the emotional reasons why she had MS. And then she used the emotional work, and now she doesn't have MS anymore. It's like, right. Like you talk about the downloads of those that are connected and Rudolf Steiner, of course, when your heart is open and your intentions are pure, and when you're curious and you're asking questions and you're open to learn and you're comparing things and you're seeing that, a carrot looks like an eye and it's good for your eye, like you're saying, right? Like all those really great things, then that's when, you're the most in alignment with not only nature, but with the planet and with the world. And of course, you're like you become in alignment to be the chosen one, if you will, and open to the information that's accessible to us. And then, and then magic gets created. And I love that, that he saw and was given that. I mean, there's so many stories of all of that throughout history, throughout people that you probably know in different scenarios. But I love this story, and I'm glad to hear that it's not just used for cancer. Because can I get some? And would it be? Can I get some? And we talked about autoimmune, because I've always, I'm the person that says, and I know you know this about me, when someone says, "Oh, well, you can't do anything about that," and I'm like, "Oh, no. Any doctor's ever said to me, you can't do anything about that?" I'm like, "Oh, yes, I can. If it didn't exist when I was born in my body and I got it because I lived in the world, I can do something about it. There's always something you can do about it, even if it's to lessen your symptoms or to whatever." Yeah. So tell us how, obviously, for the people who are dealing with cancer, and again, if you don't have her first book, The Metabolic Approach to Cancer, please get that. And again, my advice would be for a lot, and there are, I have a lot of people that I work with from your community who got to their doctor because they literally took in your book and said, "Hey, I want you to do this. So go take her class, doctor, so you can know what the heck to do with me, because I don't want what you have. I want what's in here." And same thing with this. Are all of your doctors also able to administer and help people with mistletoe? Because, I hate not giving people somewhere to go. And while I love you, so much. I loved having Chris at my event to be like, hey, he
Yeah.
works with patients. Like you can
Yeah.
work with him
Yeah.
because
Yeah.
you are taking patients.
Right.
So
Right.
I need somewhere to send people because there's a lot of people listening going, okay, now who do I go see and where do I go?
And that's just it, is that this is a therapy that, as much as it has this really cool history, this really rich history, and this really cool story behind it, it is also, it's used as an off-label drug in this country, in the United States. So there's only one pharmacy where it can be retrieved from in the US, and it needs to be administered by a physician who's been trained in this therapy, because it's not a protocol. You don't just go, oh, just take a shot once a month and you're good to go. It doesn't work that way. We do extensive labs, we get baseline labs, we do extensive questions about your current state and your medical history, and other things that help you determine which host tree, like I talked about the different types of trees that the mistletoe grows on, those are more like in alignment. Like for instance, the apple tree, the mallee form of mistletoe, is more in alignment with people with gastrointestinal cancers, so you want to work with someone who's had that type of training to know which form works best for which person, for which situation. And which dose, and then the person's experience, you have to also then help this person inject themselves, which can be a little rate limiting step for many people, especially me, like a Miss Needle phobe. That's probably what took me so long to apply it to myself, because I'm terribly, terribly petrified of needles, get very vasovagal. So after I did the first one, I was like, that was nothing, because it's a tiny little insulin needle, and it's a process of rotating around your abdomen where you put it in, you hold it, you're trained, the physician trains you, or one of their staff trains you how to do this. And you're watching for particular experiences. You don't want it to be too robust of what we call a cytokine reaction. So when you do the injection, it should be a little bit red around the area, no bigger than $0.25 or $0.50. It should elicit a little bit of a temperature rise, but no more than, say, 100.9 degrees is what you're looking at in Fahrenheit. And then you want it to be just completely done, like this response settled again before you inject again, which is typically on average 3 times a week. Some people need to spread that out further. You don't do it more than that. And so that's sort of the general guidelines of it. And your physicians are trained in it, and then they're trained in the nuances of it. So the book itself, as I said, all proceeds are going into the nonprofit to help keep research going, as well as trainings going, because the United States is the only country that this is really not part of our registered medicine. So in Canada, it's registered, in Mexico, it's registered, in India, it's registered, in all of Europe and UK, it's registered. So some places even have it covered in their medical systems, right? Or you can go get it over the counter. Now in the US, it's a little tricky. So you have to use it as an off-label drug. The bottle says sip. Your doctors are trained in how to utilize an off-label drug, because many physicians know how to use drugs off-label. That's not illegal. That's not a problem. There's plenty of data and evidence to show that, to back you on making that off-label drug use, but it is a drug. It's synthesized in a laboratory environment from a natural compound in a very particular way, and it needs to be used as such and prescribed as such. So it does require a medical license of some sort to be able to order this and dispense this. Yes, you could probably get anybody to be able to order it, but they have to know what to do with it, because worst case scenario, it could cause harm. Next worst case scenario is it does nothing for you. So if it's not implemented correctly, it falls short of what it can bring to the system. So the book itself works through kind of the why, the history of this, and then a little bit of the how-to. So it helps you, the patient, know if you're dealing with someone who's actually been trained in it, if they're following this sort of best practices guideline. That's number one. Even in the back, it has like, where do your doctors order it and things like that. So it gets down to the nitty gritty, and even the breakdown of what type of cancers will respond to what type of things. So you get a sense of this, the patient. I want you to be just as up on this as your practitioner, so that you can be in the driver's seat and they're just simply the GPS or in the passenger seat with you. So with that being said, the book itself has a website called themistletoebook.com. We're working on building out our directory of physicians on there who've come through the training. The PAM, which is the Physicians Association of Anthroposophical Medicine, PAAM, they have a list of doctors trained in anthroposophical medicine. Now, some of those doctors will not have also been trained in mistletoe. So you want to go through that list and ask that question, are you also mistletoe trained? And then there is an organization called BelieveBig.org, and they're the folks who helped fund the clinical trial that just finished up at Johns Hopkins, and that's believebig.org. And they have a list of physicians who've gone through Mistletoe training. And then on the MATC or the MTIH or the Dr. Nasha websites that we talked about earlier, we have a list of the physicians who graduated from our program, and then those physicians who've also graduated from our program and stayed in our network to do ongoing continuing education and mastermind, support. But those folks have all been through training for Mistletoe as well. So at this point, we're looking at about 300 practitioners in the United States who've been trained in this. And I would say maybe only about 50% of them feel comfortable using it, because it is not an easy therapy to apply. There's a lot of nuance. So make sure you find someone who feels very comfortable using it as well. And if they don't, have them work with their mentors who've been using it. For some of us, like for instance, Dr. Peter Hinderberger, 45 years, I think, of using this. And Dr. Stephen Johnson's at this point, I think over like 30 years. Like there's some of us on here who's been using these for decades. So we want to make sure you get the most out of what this plant has to offer. And one of the things I think is really cool about this plant, JJ is like, you've got access to people in the health field. You have access to people who can help you employ this for yourself. Like just even Dr. Duan, he's very well trained and adept with Mistletoe. But this therapy, when I think about it, sometimes if it was just me having this conversation with you and no one was around listening to us, I might think of using other therapies. There's other therapies that are in the Mistletoe family on a lesser dose called iscusen. And so they're not in the cancer treatment side, but they're in the restoration of the balance side. So all these other rhythms that can be like one of the Mistletoe remedies comes from hawthorn, for instance, which I love, the hawthorn. And then there's some that come from like the ash tree or oh my goodness, I was just thinking about this, not ginkgo, but one of the others in that area. There's they come from these beautiful trees that also, when you look at them, they say something to you. So they may fit in certain energetics of the system that need rebalancing with that, but it's still in that same kind of mistletoe family. So that's where I want your folks in listening to this conversation to just get curious and to be asking, hey, is this something that I should consider? Is this something that, hey, I have a wonky immune system, I might want to tune it up? Or, hey, I have a strong family history of cancer, maybe I want to do this some preemptive. We've had clients who've done that, who've had like BRCA gene or ATM or Lynch or GATA3 or CHEK2 and mutations that make them a higher risk for certain cancers, familial cancers. So we've had entire families go through utilizing this as like an annual, for lack of a better word, vaccine. We throw that word around pretty loosely these days anyway, so might as well throw it around with this one. So an injection that can really mediate, moderate, and modulate the immune system. And then there's folks, if you're dealing with autoimmune stuff, you can work with a provider who knows how to look at your labs in a way to say, let's start you at the lowest dose of maybe this form that's less pushing on the immune system, so we don't flare you into an autoimmune reaction. And so these are the cool things that are coming. I think this plant medicine has been around on this planet for a long time and can offer a lot, especially as we become more and more dysregulated and dysrhythmic and out of touch with the cycles within ourselves and the cycles with the world around us. I think it's, when we wrote this book, we all felt like, my co-authors and I, we felt like we were just sort of the vessel, and that it wrote itself. And we somehow feel like we're sort of stewards of this plant, of this medicine and its offerings. And so we just speak from what we've experienced personally and professionally between the 7 of us, probably hundreds of thousands of times at this point of experiences. So that's what I'm speaking to. And it may sound very foreign in this country, but if you live in Europe and you have cancer, you have anywhere from a 60 to an 85% chance to use this medicine somewhere in your treatment flow. Certain countries use it more, like Germany, Switzerland, than say France or Italy, but it's more commonplace there. My colleagues, all of the rest of the world, South America is the second biggest place of use of this. They have an entire children's hospital in Sao Paulo, where one of my dear friends and mentors and teachers, he treats pediatric cancers with us all the time in a hospital, in that setting. So we think we're ahead here in the United States on many things, but this is one we definitely are not ahead of. And so we were hoping that this book would be sort of an offering into this culture that says we're missing something that can maybe bring value into the healthcare system today.
Okay, I'm trying to remember the questions I have that came up while you were talking because I didn't want to stop you. I didn't want to interrupt you. So it's questions. All right. So number one, if someone, so me, I'm like, okay, where can I get it? When can I use it? And someone teach me. Just for the preemptive immune system boosting, because it's anything in nature. It's like eating your green vegetables. It's like eating kale. It's like you eat it because you want it to stay healthy. It does things for you. And yes, I know it's now a drug, and it's been formulated into a drug, but it still comes from nature, which most of us should have a deep resonance with and a trust with, that it has maintained the highest properties that will benefit us, and as long as we know what to do with it, we can use it. So for the people that don't have cancer but are, again, preventative, or maybe they have autoimmune disorders, will the doctors that you have trained in cancer be able to work with them? I know, because there's with how many cancer people, they're looking for help. And I know that's why you continue to keep training doctors, because there's not enough people to serve the people who need the help. So I, like, for Kristen's Dr. Duhon, like, we're talking about cancer. He doesn't have that many patients that don't have cancer, right? Because he's now kind of specializing, but it's like, but I want you to work with other people too, that I have to send you, because they don't want to get cancer and they want to use all these things to kind of help their terrain now and to do the preventative things. So do all the doctors that you have, and the ones that you would recommend, work with people like all the symptoms or all the conditions that we just named?
Well, first of all, because it has been known for the past 100 years to be a cancer therapy or a cancer adjuvant, like to support, because it's not contraindicated with chemo or radiation or surgery or targeted therapies or hormone blockade therapies. So it plays very well with others in the standard of care arena. So you will find that probably everyone who's been trained in this works mostly with cancer, right? And you will find a lot of those folks work still in general practices. They just happen to see a lot of patients with cancer. So there are definitely some that all they do is cancer. So obviously those folks, like Chris, would probably be someone who's, because of his busy schedule, would probably not be the person to call right up on this, because he's kind of focused in one particular area. But on the BelieveBig.org site and on the PAM site in particular, you will definitely find people who have more of a generalized practice who can work with you on this. And, I will tell you, about 10, 15 years ago, we were trained to not even use this in autoimmune conditions because we were afraid it would stimulate it. And we've found since then, if you use it appropriately, again, for the proper training, it can be very beneficial. And so that's one of the things where if someone is also familiar with autoimmunity and cancer, big bonus if this is of interest to you. If you are someone like you're running the deep prevention, like want to just tune up. My colleagues and I who wrote this book, we've sat around in circles and discussions because we've been presented at medical conferences in Europe where they have been doing studies on using it as sort of a vaccine, as a prevention of cancer. And we go back and forth a little bit on this because it's almost like you or your listeners have probably heard about, if you take echinacea all the time, it wears off. It's like it doesn't have as much efficacy. We have that same concern that perhaps mistletoe, if you use it too much, too often, you could actually build up that tolerance as well. So when a time ever comes, unfortunately, 1 in 2.4, 1.24 women and 1 in 2 men will have it. We want to kind of reserve the big dogs for that. So my recommendation for people who are looking at it prophylactically because of a strong family history or just really tuning up is you maybe would employ a box a year, which is a typical over like a 2-week period of time, like I said, upwards of 3 times a week maximum, 7 to 8 injections over that period of time, and then put it back down again. So you don't create that development of it. And again, your physicians are trained in this. Like for me now, for tune-ups 30 years out from a terminal cancer diagnosis, I use a box a year. That's what I do. That's like my ongoing, since I started using it in 2011-ish, I do a box, and I do it because it resonates with me. I do it at the Christmas time. I do it in December because I'm like, that just seems so appropriate. So I'm kissing under my mistletoe tree. I'm injecting myself with it. But those are some things to consider. And even a couple of the docs in the authors on the book would probably not encourage someone to use this prophylactically because of that concern. But I've been watching this enough, and a few families I've worked with do have strong family histories that are like very particularly strong with certain genetics that it's a 50-50 chance you're going to have this, that it's compelling enough to say it's worth, when you are when you have a disease that 50% of the family members will have this disease, and then 50, so that whole bit, this family of four with 4 kids, they don't want to be like, well, half of you are going to do great and half of you aren't. So it's well worth tuning up and preventing. And so what's really cool about like this particular family, they all get together and inject seasonally or, like annually together. So it's become like a family ritual because they've watched too many other family members go through the cancer or die from the cancer that they had the genetics for. And so it's compelling enough for them to say, I'll take my chances and do this box a year. Yeah.
Okay. So then that leads me to perfectly the second question out of 3. I don't know if I remember the third one by now, but was you talked about the other trees. You talked about other trees that have benefits.
Yeah.
Are those trees also given in either injectables or in tinctures or pill forms, or do you guys talk about that in this book in terms of other besides mistletoe? I mean, I know the book is about mistletoe, but you're kind of looking at the trees and what they're producing naturally. So how about any of those?
Sure. Well, what I'll do here is I'll just kind of give you a quick lay of the land of the table of contents to get that sense, because this will answer some of this. So the first section of the book is literally how to use this book. So whether you're a provider or a lay person, and it gives you sort of like, hey, if you're a lay person, this chapter and this chapter might be a little meaty on the science, but bear with us, you'll get through it, or skip it altogether if it's overwhelming. And then we have a wonderful foreword by the head of solid tumor oncology from Memorial Sloan Kettering, for crying out loud. So this is not woo-woo esoteric bullshit. Like this is well studied, well reputed. And when you have the head of solid tumor oncology writing the foreword to this book, that should probably give you a little clue, right? And then we have an intro by, Stephen Johnson, who was for years the head of the Anthroposophical Association in the United States, and really dialed in to the anthroposophical community, the mistletoe community around the world. And then we go through the first whole section is the landscape of mistletoe therapy. So into its history, the immunology, which is fascinating, especially in the world we're in today, and just the current state of research. So it just gives you the lay of the land. And then the next part is how to use it in clinical practice. So to your point exactly, JJ, is chapter 4 is all about understanding the host trees and understanding like which trees seem to resonate best with which conditions, and a little bit of the breakdown there from the most common to even some of the more esoteric ones. So that goes into that detail. And then we have a whole section, which is my chapter, which I've got a few chapters in this book, but most of them we all do together, is all about how to test, assess, and address the terrain, and specific on how to know, is that to bring your question back? Yes, on this, and how to adjust the treatments and how to know when to push with the mistletoe or pull back, or when to use it if somebody has autoimmunity and when not to, and how to use it with certain like immune therapies and standard of care, et cetera. So that gives the lay of the land for that. And then the third part of the book is the human-centered medicine part. And this is where the anthroposophical philosophy gets to really come alive. We've kind of now introduced the science, and now we're like, let's take you on a more of an esoteric journey. Might feel like that, but that's where we go into the physiology of warmth, because the whole point of this therapy is to create create a mantle of warmth around the tumor or the tumor process. But also in our world today, we've all dropped our core temperatures. So we are again out of rhythm, suboptimal. So it's hard to get pregnant if our temperature is too low. It's hard to have a good immune response if your immune system is too low. You feel your thyroid isn't working, your metabolism isn't working if your temperature is too low. So thinking about this idea is it's like raising the thermostat, in the internal body, which can have profound impact on our health, well-being, and our view of the world. And then it goes into just kind of the constitutional care, as well as some of the other anthroposophical remedies that are out there above and beyond. And then even how we use mistletoe with other therapies, like standard of care, like hyperthermia, like high dose IV vitamin C, like ketogenic diet, or other things where it has good implications. And then the last piece is sort of just unique applications and really unique cancer types, such as like the glioblastomas and certain lymphomas and whatnot. So we go into some of the cancers that aren't well studied or talked about. And when we show some really good efficacy, and we all throughout, we're sharing our clinical stories, we're sharing our case studies and clinical research throughout. And then really the last thing is sort of like, what's on the horizon? Where do we need to go with this? And so then we've got great appendices in the back. So we really have a whole section on host trees and cancer types, an entire appendix on that, which is really nice for folks. And then even those questionnaires I was saying about checking in with the patient, the anamnestic form, that's back there. What labs we'd recommend you get is back there. It's loaded with a how-to, like, again, take it to your doctor, take it to yourself.
Okay. So that was a question about the labs. So what are the indicators of if I could use this, if I need this?
Yes. So if you are historically someone who has, let's say you have lupus or rheumatoid arthritis or MS, you were mentioning that before. So for me, I've got an RA history. And so I have to be careful that if I'm going to use it, I have to make sure I'm not in a rheumatoid arthritis flare because I could make it worse. So I want to make sure I'm symptom free. Right. And I actually, weirdly, I'd gone years without any symptoms. And then this past fall, I injured my ankle and had a gluten poisoning and walked for 5 weeks over almost 1,000, kilometers, that my RA kicked up pretty ferociously. And so when I was due to give my shots in December, I actually had to postpone it until January, until the fire was out a little bit, because I was actually afraid I'd push myself off a cliff. So that's an N of 1 experience. But on a lab, I would have seen maybe very elevated eosinophils. My rheumatoid factor, which is an autoimmune marker, would have been off the charts. Maybe my interleukin 6 or interleukin 8, which are immune tests, or C-reactive protein would have been quite high. So I will still use it. That's not saying these are contraindicated, but we'll use it a little gently. Like I probably have used a different form than the one I use. I use the Mali form for me because I have a history of gynecological cancer, and that particular host tree is most suited to that. But if I had been in a flare, I might have gone and used the Abies form, which is from the fir tree, which is a lot gentler, less of those viscotoxins, so less driving of the immune train. So we would look at things like that and clarify. And even I have a kind of a prognostic score and say, folks probably should take a little caution if they answer more than 3 yeses on this 7-part quiz. Not to say it's contraindicated, but to just be mindful that you could aggravate the condition. And so again, the physicians are trained in how, when, why, where to use or not to use this in those situations.
Okay. All right. Yes. I figured that we weren't going to go over an entire blood panel and discuss but just in terms of if somebody wanted to test, or if they're looking at tests, and they even, I mean, not that the average person is looking at their blood work, but if they want to take blood work, if they want to have certain tests done just to see if it's something they could, because they've been dealing with, there are a lot of people who they've tried everything, and then they hear something like this and they go, oh, that resonates. Maybe let me do a little homework. Let me do a little research. Let me, do my own blood work and do some things that my doctor won't allow me to do because insurance won't cover it. And let me, take matters into my own before I come to somebody and say, I think I'm a candidate. I mean, my story with the fibroid stuff, right? So I did my own, when medicine changes, when the research changes, when it's around longer, and you take one therapy that you're not supposed to do if you want to get pregnant ever. And now it's a fertility preserver. In 2 years, it did a 180 in terms of what the recommendations were.
Yes.
So,
Yeah.
So you have to follow, like, I'm going to wait. And I didn't even say to myself, I was going to wait. I just thought there's nothing out there, for that condition. It was, there's a million cancer treatments and there's nothing, nothing for fibroids. Right. Oh, but it can't kill you. Just take out your uterus. Well, how about we don't want to do that?
Yeah.
So, right. But I think this is a great, because I do have a lot of very proactive, people who listen to the show who want to stay healthy and want to do the things. And so this is going to be great for them so guys, get the book and obviously go through it. And I love that we went through that like you did, because it can get overwhelming because of the science, and you want to be able to sort of jump to the section that is most in alignment with what you're looking for to answer some questions before you move forward. So you can do your homework, so you're not wasting money or time talking to a physician. It's basically going to tell you that you're not a candidate and this isn't right for you right now. And do you really need this? Maybe you should clean up some other things, to help your condition, versus this becomes like the next more extreme, even though it may be effective choice for people. So I love this. Yeah. But I'm like, what's the newest, greatest immune building thing? Can I have it?
And I think because we've all been sort of in our face in the last 2 years of really how dysfunctional our immune systems are, it really makes this like people just like really lean in and listen in. And another interesting thing I should mention here is one of the things I learned early on in my use of mistletoe, and more so the evidence is built up with it in the last few years. And really I'm looking at it now in the last 2 years, was that mistletoe therapies will only work as well as the vitamin D levels in the body. Yeah. And doesn't that just go ding, 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 because it's working on, it's pulling on certain levers, and that particular lever needs to be there to pull on. Same thing with this interacts with fats in so omega-3-6 ratios are also really key. If you've got these really oxidized omega-6 overload in the body, the mistletoe won't land as well. If you have a very high carbohydrate diet, the mistletoe won't land as well. Will it still do something? Absolutely. But can you make it work better? Even more so. So that's what I always told patients is they're like seduced by the idea of I will do this injection, it will cure me. I'm like, you still have to do your part. This medicine is a team player. This medicine plays well with others, and you are the host that medicine is now landing in. And what you've done on the interior that it lands on and in is going to make or break the response to that therapy as well. So that's why a lot of doctors or a lot of patients may be like, well, that means I have to work hard for this. Well, guess what? You're going to have to work hard no matter what. When you're dealing with a chronic condition, you have to change the terrain. You have to change the soil in which you got sick. There is no way of working around that. There is no pilling or injecting your way around that. You have to do the work. And it's not the popular belief system. No one wants to hear that. They so want it to be easy, the easy button. But it's such a profound therapy that enhances the impact of standard of care therapies. It helps offset the side effects. It helps you tolerate the therapy better. It helps you overcome the resistance and have a longer overall, better quality of life and a longer overall survival rate. I mean, those are what the studies show again and again and again with standard of care. But it also is going to work a lot better if that patient is also doing their homework on what they do have control over in their diet and their lifestyle and their other supplements that might be supporting this process. So I thought that was worth mentioning, given the nature of the world around us. Like everyone's, out there like, oh, just give me the pill or just give me this off-label drug that I can pick up online to treat or prevent this condition. I'm like, I hear those stories and I cringe. I'm like, the side effects of what those drugs can do to you? Yeah, they might seem, they're really innocuous. They knock out so many things. And I know they're sexy and very popular right now, but man almighty, they're causing other disruption and other imbalances. So I look at how mistletoe comes in as sort of like a warm blanket that just that you can get cozy under while you're nourishing and nurturing yourself back into a place of optimal health.
All right. One last question, because you and I could do this all day long, and I know you got a busy schedule. And is that vitamin D level? So I know, and correct me if I'm wrong, that if someone's dealing with cancer, they want their vitamin D levels up into into 100. But what about the average person who wants to incorporate this? Maybe it's an autoimmune disease or disorder, a low immunity, and they want to what's the minimum number for their vitamin D levels, do you think, to make this work?
Well, it's interesting because there's definitely camps out there who talk about the danger of vitamin D supplementation or just being really vehemently against it. And maybe it's because I'm a Libra, but I hear their point and I understand where they're coming from, because ultimately we should be getting our vitamin D from the sunshine. Number one, that means getting more than 70% of your body exposed every single day for at least 20 minutes to get your 10,000 IUs a day that is necessary. Now, there are parts of the world, even if you're butt ass naked and out for a whole hour, this time of year, you're not going to get enough vitamin D. It's just the nature of the latitude longitude game. And so there's that side. So yes, in perfect world, that's how we'd all live closer to the equator and we'd all be running around naked. Like that is how it works, right? That's what I do now. That's what I do now. So, and then the other thing is if you can't get it all there, then you would ideally have gotten it from your animal proteins, your lard, your backstrap, your pastured dairy, your pastured meat. Not a popular idea for folks today, especially in the last 50 years where we've scared everybody off of fat, and especially in the last few years where we've pushed everyone into the vegan world, which you will have low vitamin D levels in that population. I tested them all and it's never been normal. And then you end up with folks that if they take too much vitamin D, you can actually suppress the immune system, which we will use, interestingly enough, clinically. We can actually when you're a doctor and you're looking at the labs, you can actually use vitamin D levels like a steroid, because it is a steroid, but you can use it in super high levels. You suppress the immune system in an overactive process. So we do want people to be mindful, don't just go out and take tons of vitamin D, because that will also blunt the immune response. So again, it's this beautiful, delicate balance and dance. So we don't really know what the right level is. Okay. That's where the literature does come around. So for me, sunshine first, food second. And then looking at if you have, then obviously look at your labs. And if they're still low, that probably tells me you have an epigenetic issue. That means it's harder. You need to take in a lot more to get things to move. And then we also want to always pair it with the other fat soluble vitamins, vitamin A, vitamin K. That's why our grandmothers and our great grandmothers took cod liver oil, for crying out loud. It is the perfect blend of the ADK. We all pinched our nose and fought it, but the wisdom has been there all along. Or you eat the whole animal, you eat the organs, you eat nose to toes, that's how it's done. That's how you get those incredible and immune balancing, pieces here. The labs in the US, because there's different ranges and different like nanograms per kilogram, like whatever, what we use typically in the US is ranges from somewhere from 30 to 80 or 30 to 100 is usually what we see on the lab ranges in the United States. And what I'm finding in my clinical practice and those of my colleagues is keeping people up who are dealing with cancer at that high end is what's ideal. And for the prevention of, if you're a quote unquote healthy person, which only less than 12% of us are on this planet, probably keeping them at least 50. I know. Oh, yeah. At least at 50 would be key, right?
Okay.
If you're dealing with autoimmunity, maybe 50 to 80, like a chronic illness, probably push it maybe between 50 and 80. That was kind of a general rule of thumb, but people need to watch their serum calcium. They need to bring on vitamin K2. Again, please work with a doctor because it is a multi-lever steroidal hormone that you're putting in. It's not a vitamin. It's actually a misnomer that D is a vitamin, but it's a critical player. And so when people are like, no, don't supplement it, and you hear those camps all the time, well, we're in trouble. We need to. And I watch people completely change their physiology, change their labs, change their psyche, change their metabolic markers, change their blood sugars, change their cardiovascular symptoms, change when I supplement them into appropriate levels, when we've exhausted what the sun and the food and the epigenetics are capable of doing. So I'm a fan of bringing that on and using it. And then the body gets to a point where it can maintain it. So it took me almost 2.5 years to get my levels from 7 up above 50 with 50,000 units a day. That's what it took for me. And that's, if you knew my medical history, you would know it would all make sense. Today, without taking any vitamin D, except for when I get on an airplane, I blast it when I get on an airplane, or I take high doses if I have an RA flare, my levels run around 90.
Naturally. You do lay in the sun.
I live down in Mexico and I follow the sun. Because for me, I would prefer to get it in the way it was intended, through the skin and through my food. And so that's the piece. And I will supplement when I'm under the weather or over the weather when any flares happen, which are very far and few between for me. But that's my N of one, right? And I've played with this dance for many, many, many moons at this point.
Awesome. All right. So a lot of information, because she can just keep going and keep going. Number one, and all day long, I've been with her for weeks at a time. So anyway, Mistletoe book, right? Because it's a passion. It's a passion because, like you said at the beginning of the show, when you were dealing with your cancer, you didn't expect to live. So you kind of surrendered from the very beginning, which meant your relationship to all of this information was almost like curiosity, like, oh, right. And now what it can do for others. And you see the power in that. That is why this is not, I just did it to survive and now I'm done. This is a constant conversation and curiosity of things that are available to people that can help save them, their lives, their health, and on and on. And of course, I think it's so cool to get, the more we get into the nature aspect of our being, right? There's nothing more spiritual than, side note, when I did get married in Hawaii, my mother said, because we come from like a Catholic / Orthodox upbringing, and technically I would not have been allowed to get married outside in an Orthodox ceremony. And so of course we got to get married in Hawaii, and we're on the beach, and there's the mountains, and we've got sand and water and fire and all the elements. And she comes back and says, well, that is the most connection to God we can have. I don't understand why someone can't get right. Like it's that we've built our lives in outside of nature. And if we can't get back to nature, we will not thrive. And so anything that's connected to sort of the source of all that is on this planet and above, and below, then, that's sort of the theme of my show. So I appreciate that you came on to educate us. Please, everybody, get this book. Also, The Metabolic Approach to Cancer. If you know anyone who's dealing with cancer, please make sure it gets in their hands. If you can't find a physician, drnasha.com. All the links that Dr. Nasha mentioned will be in the show notes below or below this video. So again, you can utilize and access that information. And of course, if you have a doctor that you love who isn't doing this, just buy them a book and take it.
Join our merry band. Yeah.
Right. We are trying to build the team here. So thank you so much. I love you. And I love that you come on to share information. Of course, you're welcome at any time. You don't even have to ask. Just tell me, hey, I want to come on and talk about something. I want to share something, and I will make room for you in my schedule.
Thank you so much. Blessings to you and all your listeners.